We're so glad you guys could join us today. We're going to be talking about lipids and natural ways to manage cholesterol. And I'm really happy to be joined by Dr. Rosalie here. We are the naturopathic physicians here at Prosper Natural Health in Port Townsend, and we have this lovely opportunity, I feel like, to provide patients and our community with more resources than some of just the standard ways and the conventional ways of looking at the medical model. And when we're thinking about lipids in particular, one of the big pieces that we're going to be wanting to really talk about today is this impact of the lipids on our system in regards to inflammation and ways that we can really support our bodies naturally, not just with pharmaceuticals, but also with diet, lifestyle, exercise, and nutraceuticals. And we want to go over some of the really cool new information that's out there about this. So we do these doc talks as a way to get information out. We've got a lot of people that ask similar questions, and this is just a way that we can kind of help people understand certain health topics. And we've recorded these, and they're on our website. So feel free to go back through and watch recordings that might be applicable to you, or if you have a friend or family member that might benefit from some of these. We try to put a lot of good information out there and to make it really something that you guys walk away with having more knowledge around these topics. So, of course, today we're talking about cholesterol and lipids, and we want to talk about what might be some of the ideal ranges for cholesterol in the blood and get you guys kind of understanding a little bit more about the testing in regards to lipids, because there's not just the standard lipid panel that's available for that. And some of these other markers really help us get a much better, accurate picture for what's going on for our risk levels as patients. And then we're also wanting to talk about this idea of if these blood fat levels might be related also to blood sugar levels, because that can really unlock a key for a lot of patients who are struggling with high lipid numbers. And then understanding what it means when you're looking at your own blood work with the lipid panel, and then talking about alternative treatments, right? That's one of the reasons why we're all here. For example, natural alternatives to our standard prescription medications, which really fall within that statin category. So we're hoping to get that covered for you guys today. So let's talk about what cholesterol is. One of the things we like to do as naturopathic doctors is take a step back and say, can we understand the basic physiology and how things are supposed to work? So remember, cholesterol is actually doing a very important set of roles in the body. And a lot of times we vilify it, right? Like, oh, cholesterol, that's a bad thing. Well, actually, cholesterol is so vitally critical that it's in every single one of our cell membranes. It makes up this beautiful, it's called a phospholipid bilayer. You can see this really cool little sphere here. So that's a picture of a cell in your body, and it has this layer around it which protects it. And inside of that layer, there is woven in cholesterol, and it helps give us structure. So we actually really need cholesterol. It also is a backbone for all of our steroid hormone production. So that means our estrogens, our progesterones, our testosterone. We need it as a building block. We also know that cholesterol is absolutely very important for our brain. It's stored mostly in fatty tissue. We also know it's critical for bone health, specifically in marrow, and it's helpful for our skin with our elasticity. Remember, it provides structure for our cells. And then the endothelial function. So what the heck is endothelial? That is the inner lining of our vessels, our blood vessels. And so it helps provide this elasticity. Now, too much of even a good thing is a problem, and not enough of a good thing is a problem. So one of the things we're constantly trying to work on with our patients is this understanding of finding balance. So we just want to put that out there, that we don't want to vilify cholesterol, and yet too high of cholesterol can be very damaging, of course, as well. And we see that reflected in the medical literature.
So too much of a good thing is something known as hyperlipidemia. So too many lipids, which contain cholesterol molecules. So high blood fats, if you could see on the right there, the blood that's been centrifuged, you can see the fatty layer in this hyperlipidemic blood. It's exactly what your blood looks like when there are a lot of fats in there. So we commonly see the blood look like this right after a fatty meal, say a steak or some chicken tenders or something. Immediately after, of course, the body has taken that from the GI tract, put it into the blood. It's going to store it somewhere later. But this is, it's definitely of concern to have that much fat floating around. Some bodies hold on to this amount of fat long term in the blood, and that's where we see really high levels, including in like genetic types of like familial hypercholesterolemia. So, why this is a concern is because high blood fats, namely LDL, which we'll get to later, is associated with a whole slew of cardiovascular disease: heart attack, stroke, atherosclerosis, peripheral arterial disease, hypertension, not to mention obesity, fatty liver, one of the organs that has to process all of this fat, diabetes, and then a big one that we often forget about is actually erectile dysfunction. So it's just so much is linked with this state of having too much cholesterol. So when you go to get your blood drawn for a standard annual panel, usually they add on what's called a lipid panel. These are actually calculations. They're not actual particles of cholesterol of different kinds. They're calculated particles. So you go through a fasting blood draw, at least 8 or 10 hours of fasting to get these calculated levels. We look at the calculated LDL, which is your low density lipoprotein. Basically, what that means, if you imagine a glass of water, something that's low density sinks to the bottom. If this is an artery, low density sinks to the bottom of the artery, right? So you can imagine that being bad and contributing to atherosclerosis. HDL, high density, this is one that floats to the top of your glass or to the middle of your artery, right? So we want more HDL around. It's a cardioprotective kind of cholesterol. We want much less LDL around. Those two in concert with each other can contribute to a risk ratio, another calculation, it's in an algorithm, that tells us about how likely someone is to have a cardiovascular event, like a heart attack or an ischemic attack in the next 5 years, right? So those two in concert. If you have low HDL, high LDL, your cardiovascular risk definitely increases 2-3-fold. Triglycerides are an interesting additional piece here, a type of lipid that's specifically made from carbohydrate intake. You eat carbs, you store it as fat. Okay, so again, your diet very much reflects how many triglycerides you will store. So when I see patients with high triglycerides, it tells me way too many carbs in the diet. So yes, blood cholesterol, blood sugar, very closely related. Your cardiovascular risk ratios I already talked about, and just below here is your kind of standard lipid panel. What we see commonly is some sort of pattern like this. So the different types of cholesterol, remember there's those 3 kinds, the LDL, the HDL, the triglycerides. Everything comes from a dietary source, right? That goes through the blood vessel, and the body does its metabolic step to solidify it, store it, and process it. And the liver is the big organ that does that. Whole lot more biochemistry here in terms of and genetic predispositions as to which bodies, which livers do this very well and which livers don't. There's certain genetic types that just really hold on to triglycerides, those carb-related fats. And there's some other genetic types that really hold on to the other low density cholesterols. If you have a family history of heart attack or stroke or heart disease, it's there's usually a big component here that's genetic. So thinking about triglycerides again, these again, remember, are your carbohydrates stored as fat. The body does this because it wants to use this as an energy source later on. So this makes a whole lot of sense in our Paleolithic days where we would just have carbs all summer, berries of all sorts, and then store them for later in the winter when we needed more energy and we didn't have that quick, easy glucose or carbohydrate source available. So it's useful. It's a biochemical adaptation. Like I said, genetics are largely involved in what kind of bodies store these triglycerides as compared with other bodies. The biggest take home here is that the triglycerides are actually a marker of insulin resistance. So thinking back about like, how does blood sugar play a role in here? If you eat a carb, it goes absorbed into your from your GI tract into your blood. And then insulin is the hormone that's released when it sees the blood sugar go too high. Insulin is the hormone that takes the sugar out of the blood, stores it, right? So triglycerides are actually a way for me to get a sense for how insulin resistant someone is, which is a marker again for prediabetes and diabetes. So all of this is inextricably linked.
And we know that with diabetes risk comes a higher risk of cardiovascular disease, specifically this damage that's being done by these higher amounts of sugars along the vessel lining. So very, very important that if your triglycerides are flagged as high, that's really looked at in combination with this idea of, is there something going on with carbohydrate metabolism and blood sugar? So such important information. Now, one of the reasons that many of you, of course, are here is because you're really interested in some of these natural interventions that can be available in regards to lipids and to cholesterol and things that are going to help us with our cardiovascular health. And there are many options here. So, of course, we have to start with movement, right? So there is a lot of information in the medical literature about aerobic movement and exercises that can help improve our lipid panels and our cholesterol panels. And one of the things that we saw when we were looking at this is that there are some even newer research pieces that are coming out. And this one was done just last year in May of 2023. And it's looking at a systematic review of many, many different research studies. And it's saying, you know, we really see a major improvement for younger populations in particular whenever we're looking specifically at the lipid panel after they've been doing these aerobic exercise routines versus some of our patients maybe that have kidney problems or prior cardiovascular disease. We might not see aerobic exercise alone do that much of a change. Now, that's not to vilify exercise at all. In fact, it's very, very important, and we're very much wanting our patients to exercise. And we know it's so important for fat metabolism to be having that frequent movement as part of their routine. The other piece that this brought about in this study was specifically cardiac rehabilitation types of exercise. So it's important to think about that if lipids are an issue for you, or if your cardiovascular system is an area that you feel like really needs attention for your own health, making sure that you're building a type of exercise plan for yourself that includes things that involve cardiac rehabilitation. And a lot of times we see those being aerobic activities that might make us kind of get a little bit short of breath when we're doing that exercise. So for example, that might be like walking with more intensity or getting on a stationary bike, something like that, for example.
So as naturopathic physicians, part of the treatment algorithm that we use is like using the least invasive interventions first, right? So when we have a patient walk into our clinic, into our office that has high cholesterol, we reach for diet and lifestyle changes first and foremost. And then from there, we talk about other interventions, supplements, you name it. And then from there, we talk about, okay, potentially adding in a prescription medication or using this in concert with a prescription med. So that's why we're kind of starting with these lower lying lifestyle and diet change research articles with you. So is always kind of part of the groundwork for a naturopathic treatment plan. What's really amazing with hypercholesterolemia is that a plant-based diet, also known as a vegan diet, is absolutely amazing for diminishing your cholesterol levels. This is a excellent piece of science here, 2023, meta-analysis of randomized control trials. So when we think about how well a study is done, we always think gold standard are our randomized controlled trials. When we do an analysis, a meta-analysis of these gold standard trials, this is like the most beautiful, exciting, articles of science that are out there. So, we get a little nerdy about when we see these types of studies in our research prior to the doc talks. So, in essence, vegetarian, which includes eggs, dairy, and vegan, which omits eggs and dairy. Both of those diets have, when they're pooled together, have a significant reduction in your total cholesterol levels, your LDL, remember that's the low density, bad type of cholesterol, and your ApoB markers. We didn't talk about ApoB, but it's something we'll address in later. It's an independent risk factor for cardiovascular disease. Okay, so it's another way of looking at if your LDLs are high, okay, is also your ApoB level high? If that's the case, I would say your cardiovascular risk is much increased as compared to the opposite. So raw data here, again, meta-analysis, we don't know the specific duration of the treatment, but we know that, okay, vegetarian or vegan diets as compared to a regular omnivorous diet, total cholesterol went down by 7%, LDL 10%, ApoB by almost 15%. I will say clinically, I've seen even more impressive numbers. Someone just the other week came in with total cholesterol of 300, diminished it by 80 points in a month. So it's just like when you're able to make a huge shift from a more like omnivorous, if not carnivorous type diet to a fully plant-based, we see an amazing shift. And that's because the intake has diminished, right? The cholesterol intake is less. So thus the body has to deal with it less in the blood.
And we like to think about this balance with patients where when they're in a state where their cholesterol might be so high and so dangerous and plaquing is occurring for their vessels, using these dietary techniques may be something that helps them bring them back into a safer, normal zone where they're not having that inflammation and that damage from the lipids. And then we can talk to them about starting to reintroduce certain maybe proteins that come from animal sources. So once again, we don't want to vilify any, diet that has, some animal source proteins in it, and it ends up being right for some patients, but we want to look at it in an individual situation for each of our patients and look at where they're at as far as risk. So what a powerful tool to say, hey, let's switch over to this plant-based vegan lifestyle and get these numbers to fall in line. And then also, like Dr. Rosalie was mentioning, we have so much genetic material here that is involved that there are some people who are going to do better with those kind of modified diets longer term. This study is another beautiful meta-analysis, and it really starts to get into specifically fiber. Now, there's an entire type of pharmaceuticals out there for cholesterol called fibrates that are available But we have natural fiber as well, which is available for our patients dietarily as well as supplementary. And we know that when we include fiber, which naturally shows up in our plant-based foods in particular, we are going to help reduce the amount of cholesterol that gets absorbed, and we can significantly reduce some of these more concerning profiles of the cholesterol panel. So this meta-analysis was looking at what happened as a dose-dependent amount of fiber. That means the more fiber that was added into the diet, the more reduction there was in certain types of lipid markers. So they saw, the researchers here saw that there was a significant reduction in that more risky LDL cholesterol, as well as a reduction of that apolipoprotein B after soluble fiber was increased in diet. And then they even went on to say that 5 grams per day increase of soluble fiber in these study subjects' diets would significantly reduce triglycerides even further. So that's a big deal to see these numbers decrease, and especially seeing that in such a large meta-analysis is pretty exciting. So remembering to include your roughage in your diet. So that's why we have that beautiful picture of that vibrant Swiss chard here. And not forgetting to, I always try to tell people, like, eat the stems, cut these beautiful plant foods up and have them and enjoy that important fiber element, because that's going to be so protective for cardiovascular health and beyond.
So getting a little bit further into supplements here, if you know about, the alternative world of what gets prescribed for high cholesterol, you've probably come across red yeast rice. Red yeast rice is actually a fermented product from rice with a very specific type of microbe that creates a constituent that works very similarly to how a statin works. Statin prescriptions were actually developed from red yeast rice studies. So if I have a patient with very high cholesterol, we talk about red yeast rice with them, in that the way it works is it diminishes, it blocks an enzyme that otherwise absorbs fat into the blood stream. So it blocks that enzyme. Blocking that enzyme requires an antioxidant always to be paired with it. So whenever you take a red yeast rice or a statin, you always add an antioxidant called CoQ10. If you don't have all that on board, it's definitely required. It gets depleted otherwise. What this meta-analysis showed is that red yeast rice for just 12 weeks was equivalent to a statin, a moderate dose statin, in that it lowered total cholesterol by 33 points, LDL, which is that low density bad cholesterol, by almost 29 points, and triglycerides by 23 points. So remember, triglycerides, we haven't talked all that much about in terms of how do we diminish those in the fat, besides diminishing those in the blood, besides diminishing carb intake. But red yeast rice is a supplement that touches on all of these different types of fats, while also increasing HDL, which is that cardioprotective type of cholesterol. We want that one to be high. Exercise also increases your HDL, as does red yeast rice.
The next natural substance that really needs to be highlighted here is niacin, and that's B3. Now, this is one of the most powerful, when we look at the medical literature, natural substances that we have to support against dyslipidemia or hypercholesterolemia. Now, one of the pieces that niacin does, this B3, is that it really significantly increases that HDL. Now, Dr. Rosalie just mentioned that HDL, that more protective form of cholesterol being raised by exercise effectively. And we now know red yeast rice as well. But niacin's an even stronger actor in comparison to red yeast rice. So when I'm thinking about ways to really support that for patients that have low HDL, especially if they genetically have low HDL, I'm usually thinking about niacin being something that they're taking. It's a nice one because it's something that you can add on to a statin prescription for patients who are already being managed via statins. The biggest challenge with B3, this niacin, as many of you have probably heard of the niacin flush. So part of what it's doing as it's affecting our lipids and our fat metabolism and reducing the triglycerides, the lipoprotein A, the LDL, while increasing the HDL, is that it's increasing the speed of the metabolism of some of these fat stores. And so we can get this flushing effect that happens, and it feels like you're too hot, almost like a hot flash that can happen after supplementing with niacin. Now, there are many different forms of niacin. There's non-flushing and flushing. What I've seen from the medical literature and what we've seen in practice is that the flushing form really does come with this therapeutic effect for the lipids, whereas the non-flushing forms of B3 can be very potent antioxidants for other areas of the body. But when we're thinking about cardiovascular support, we're usually thinking about the flushing version of B3. So often we're thinking about a controlled release option, and we'll be talking about that more in a minute here.
Bergamot is another sort of newer supplement nutraceutical out there that's been researched. Again, this is a meta-analysis from 2022 that included 14 different trials utilizing bergamot. And what it noticed is that, yes, bergamot does indeed diminish total cholesterol, triglycerides, and LDL while increasing HDL at levels that are almost more impressive. Again, we don't know the duration of time here because the 14 trials all have their different durations of time, but you can see here total cholesterol diminished by 63 points, triglycerides by 74 points. These are really, really large numbers equivalent to like a moderate to high dose statin, as well as the LDL diminished by 55 points. HDL increased by about 5 points. So just like really epic changes with just a nutraceutical.
We also have plant sterols that have been getting a lot of attention lately. And this is a nice study from 2023. Now, plant sterols, we think about these working by keeping the cholesterol that's coming in dietarily from coming in into the circulatory system. So helping block that, and essentially, you're pooping out the cholesterol rather than absorbing it. Now, with these, there's really great evidence that they can help reduce specifically those LDL levels, which are more concerning. We don't see that same improvement effect with the HDLs that we do with with the niacin, the bergamot, the exercise, the red yeast rice. So once again, these are chosen specifically depending on what your lipid panel's looking like and what your genetic needs are as well.
So certain people don't need a diminishment of all of the cholesterols. They just need help with the triglycerides, or they just need help with the LDL, which is why we kind of pick and choose which supplements come in, which dietary interventions come in. It ends up being an individualized recommendation. So thinking about this from the Ayurvedic perspective, which is traditional medicine from India, this most common herb that gets used is called guglu. It's actually a plant resin that diminishes cholesterol. So some of my patients who prefer a more Eastern approach or a whole herb as compared to taking like a supplement I will have them take some Google instead. So again, this meta-analysis showed a decrease in both total cholesterol and low density lipid by 16 points here and 18 points respectively. This was also an interesting article or scientific primary literature that talked about other interventions that we don't go into detail today with, but it has some more Eastern type herbs in there, like garlic, black cumin. So if you do this research on your own, you can kind of read this article and see what else gets used in the traditional Eastern medical world.
There are a lot of really cool tools out there. So going back to that idea of this individualized approach, it is very important to utilize the science that we have of lab work to understand what's going on with an individual's lipid risk and how that's going to affect their overall system, because we do not want too low of cholesterol. As we know, that's going to be problematic. And we do not want too high of cholesterol. So we want to meet there in the middle and have that balanced. So one of the challenging pieces for us as naturopathic physicians and just as primary care physicians in general is often access to care for certain patients, especially if they have an insurance model that they're using that doesn't allow frequency of testing that should be available, in our opinions, for monitoring their lipids, or even allow them to step out of just that base lipid panel that shows total cholesterol, LDL, HDL, and triglycerides. So those are important markers. And, we based a lot of that research that we shared with you today because that is what our scientific world uses to communicate regarding lipid levels. But that's really just the base window. And we know that there are so many more powerful markers to get a better understanding on what's going on with the cardiovascular system. So one of the things that we try to offer to our patients here is an annual wellness panel that's very competitively priced so that they can afford to get it done, which has not only their basic metabolic panel and their complete blood cell count, looking for anemia and how their immune system is doing, but also one that has their lipids as well as certain minerals and other vitamins like vitamin D, and looking at their hemoglobin A1C to understand what's going on with their blood sugar regulation. So we often will start with that for our patients and recommend that some kind of panel that's comprehensive like that is done yearly so we can know not only what's going on for them if there's if something out of balance, but also to have a baseline if they are healthy to know what their normal is so we can look for trends as things to start to change. We often will also request patients that are having metabolic challenges, they're having high triglycerides and having difficulty with their blood sugar, to do something like our weight support panel, because it will allow us to look a little bit deeper into some of these other hormones and markers that regulate that metabolic system that is going to be at play with how they're breaking down their carbohydrates and how that's going to impact their cardiovascular health. So that adds on things like the adiponectin, the insulin, and the leptin. And these often are really challenging to get ordered through an insurance-based model, frankly. You often have to be truly diabetic in order to get that. So that really excludes a lot of our pre-diabetic patients or all these patients we want to be working with preventatively. The other piece there that we offer for a lot of patients who have higher risk of cardiovascular issues, or they want to be screened because their family members have had cardiovascular issues, is our comprehensive our comprehensive heart panel. And this is so important to us because we know cardiovascular disease is our #1 killer here in the US, and it helps us break down those lipids into something that's very powerful, in my opinion, which is considered or called a fractionated panel. So the first thing you'll see listed here in this comprehensive heart panel is an NMR lipo profile. Now, if you've never heard of fractionated lipid profile, I really want you guys to listen into this part. This is the much more accurate look at your lipids. And it just so happens that even though Dr. Rosalie and I have been talking about how HDL is so helpful and good, in truth, when you look at HDL, there are different types of HDL. There's HDL that's denser and HDL that's more buoyant and will truly stay in that lumen of the blood vessel in the mid zone and can help with patching up problematic areas of the blood vessel that's been damaged. Now, what this fractionated panel does is it tells us about the actual density of both your LDL and your HDL. You might have noticed in those studies, a lot of the write-ups will talk about LDL-C. Now, what does that C stand for? It actually stands for calculated. And what that means is this is a calculated average they're using a computer-based model when they're looking at your blood sample to come up with your numbers there. Now, this is different than these fractionated panels where they're giving actual number reports because they're fractionating them out and saying, here's your low density, here's your medium density, and here's your high density within both the LDL and the HDL. And that gives us so much more powerful information. And in fact, there have been times where we see somebody's HDL that's at 90 and we're patting them on the back saying, good job, good job. But actually, that's an inflammatory response where the liver is mobilizing more of these HDL to do tissue repair for the vessels. And so this is where we actually get much more valuable information, in my opinion, when we're truly concerned about lipids. This panel also does our apolipoprotein B, which Dr. Rosalie mentioned as kind of an independent cardiac marker, as well as lipoprotein A, which is very much an important marker when we're thinking about this ratio of how these lipids are being managed by our liver and by our body. We also, of course, want to check some inflammatory markers. So I kind of hinted earlier about how inflammation plays in here, but as we can understand, if we have a lot of dense lipids that are going to be collecting around the edge of these vessels and causing atherosclerosis, this narrowing of the tubes of our vessels because of the plaquing, then we have this inflammatory response that happens. And that's where we really start worrying about chronic disease, degeneration, and long-term damage. So we would love to know what the heck is happening inflammation-wise for our patients that might have elevated lipids or lipids that are dysregulated. So looking at that high sensitivity HRP, that's HSCRP. This is more accurate than our standard HRP. It really gives us an idea if there's even small amounts of inflammation that might be going on in the vascular lining. And then specifically homocysteine, which is one of our most accurate pieces of information on lab work for what is going on with the inflammation in that endothelial lining of the blood vessels, so that inner lining of the blood vessels. And then we love being able to check on the insulin, again with that panel, as well as the hemoglobin A1C, checking in what's going on with carbohydrate metabolism, and then also being able to make sure that the person has what they need in regards to their microminerals, such as magnesium, that regulates the vascular elasticity. And then we also really love to be able to check in on fibrinogen activity. Now, if you've never heard of fibrinogen activity, it's essentially the marker that tells us if you're at really high risk of stroking out now, like immediately. So it helps us understand some of that risk for stroke and for this clot production. So not only are there labs to figure out what you need, but of course we want to talk about specific nutraceuticals and supplements that we use if our diet and lifestyle interventions that we start with as our foundational therapies are not strong enough or not getting us to that therapeutic effect that we need, or if we're starting in such an imbalanced state that we need to pull in a few more of these tools. And we covered a lot of these different ingredients here with our with the medical literature that we just shared, but Dr. Rosalie is going to jump in and talk about some of these as well.
So as you can see, these are some of the supplements that directly relate to the research we were talking about. Got a whole lot of these designs for health products, the ones that are on the bottom. The reason we put that many in is because they do just a great job of like having very specific ingredients. So it's like if we're just looking for the red yeast rice, we pull for that one. If we just want the niacin controlled release variety, we pull for that one. The foresterols as well. Bergevin has additional endothelial support with actually red grape, I believe. Yeah, red grape. So it's just an additional it's got that bergamot, but then an additional antioxidant from the fruit world that helps protect the endothelial lining. So we use these in different patients, right? In these kind of, solo products. If there's a big picture of like, okay, the whole cardiovascular system needs to be supported, I use more of a combo product like the Mountain Peak cholesterol support, which has a lot of these antioxidants, vitamins, as well as red yeast rice, CoQ10 in it. And it's more of like a kitchen sink perspective where it's like, okay, we'll add one pill at a therapeutic dose as compared to like a combination of things. Of course, what's really important to me as a clinician is to test blood levels at least quarterly, if not every 4 to 6 weeks, depending on my patients, to see, okay, what did the intervention do? Whether it's just diet, whether it's a supplement. So that's really important to me. We're definitely big on getting the lab work and just checking that as kind of finding our way to optimize health. All the way on the right-hand side here are different kinds of fiber formula. Sun fiber is a type of guar gum soluble fiber, which is helpful in my patients who have digestive concerns like SIBO or microbiome overgrowth. That's a safe fiber for them. The fiber formula below that is a combination of soluble fibers, including the guar gum, that has your 5 extra grams a day. That's kind of the therapeutic amount we start with. Remember, if you're taking fiber, you want to take it away from your other supplements because it does a great job at binding everything. The cholesterol, but also all these other wonderful things you might be having in your supplements.
And, these are all, wonderful products that we utilize with our patients. But of course, it's important to look at what your needs are. And for dosing, those things can change quite a bit. As far as the big thing that's missing here is fish oils. Did you guys think like, what about fish oils? They haven't talked about fish oils. So the reason we didn't do that is because we have a specific talk that was all about fish oils, and that was just done in June. So make sure you go on our website if you're interested in the cardiac impact of fish oils. Pretty incredible. And we've got tons of information there for you. And then also, we just wanted to remind you guys that we did a talk not too long ago in May on blood pressure. And so that is often related because remember, if we have lipids that are out of balance and we have potential plaquing going on in the blood vessels, if we have extra pressure there, then our risk of cardiovascular damage is so much higher. And that's where we really start to stack things. So once again, as naturopathic physicians, we really try to step back and look at the whole picture. And we don't want to just say, okay, lipids, that's the only place we need to focus on. So if there are other concerns, once again, that you or family members or friends are having in the cardiovascular realm, do kind of put all of those pieces together when thinking about health. And they're, once again, available online, so free to watch. The other big piece here comes down to this lovely balance.
And this is sort of like bringing us back to the bigger picture, right? The naturopathic kind of medical philosophy. It's just, we're looking to optimize health and diminish disease, right? We're looking truly at optimal levels. And so if you have a whole lot of stress, whether it's internal physical stress, emotional stress, external stress, you know, all of that is sort of weighing down on your inner resistance, your resilience, your physical and psychological pathways that contribute to a disease state. If we're able to build your innate ability to heal with the least invasive therapies, then we're building that internal resistance. You're building your resilience. The stress has less of an effect on you. So it's very much, it's just this balance. It's really zooming out and thinking about it from a holistic perspective. And we're thinking about this for vitality, right? We're boosting the positive factors, trying to diminish the negative factors.
It always looks so simple on paper. I always kind of laugh about this, but it is so very true that we want to be thinking about providing that extra resistance because life has stressors. And speaking of stressors, many of us might get excited about the holidays coming up, and they sure are. So we are going to be doing a talk on adaptogens in December. And if you haven't heard of that odd word, it truly means to be able to adapt and to have that resilience and that vitality to resist against stress. And so adaptogens are this phenomenal set of mainly herbs that we have available to us in the natural realm that can be helpful for supporting the body against stress. And this isn't just a mental and emotional stress. We're talking about actual physical stress too. There are some amazing studies we're going to share with you guys about athletes using adaptogens, for example, that are having physical stress. So we would love you guys to join that. So make sure you register when you see the invitation. And then, of course, we want to invite you if you have questions about what's going on with your cardiovascular health or your lipid profile, or maybe you just had your annual labs done with your primary care and you want to bring those in, we're happy to look over those with you and help you optimize those. And additionally, just a reminder that this is in Washington, we are a self-ordered state. And what that means is it gives patients the autonomy and the legal ability to ask to have labs ordered. They might not be covered by insurance, but to have labs ordered that they're interested in ordering for themselves. So if you do want that more intensive fractionated lipid panel done or some of your inflammatory markers done to kind of really put the puzzle together for you and understand what might be helpful as far as interventions, we're here to help. Just give us a call or check us out at prospernaturalhealth.com. And we look forward to working with you guys. Thank you all for joining. Should we do some questions? I don't know if there's anything in the chat, but I can see if anybody has any questions, feel free to enter them to the chat and we'll do our best. Just wait a second. And if not, that's fine too. You guys are great, and we really appreciate being able to share this information. Oh, great question. Okay, so we've got a question about what menopause, how it has an impact. So this is actually really fascinating to me because remember how we said at the beginning that cholesterol is this steroid hormone, and it is or a steroid hormone builder, it's building block. So what happens after all of a sudden we stop building a lot of estrogens, especially as women going through menopause or folks with uteruses going through menopause? So we start to have this change that happens where all of a sudden we have a lot of these building blocks hanging out. So this cholesterol actually physiologically increases. And what's always interesting to me is we get these lab panels back and our reference ranges are really not based on necessarily age groups for our lipid panels or gender. So it's always something that I expect to see about 20 to 40 points increase in total cholesterol during those initial menopausal years. And that to me is physiologic. I don't get really worked up or scared about it. And I'm trying to usually explain that to my patients that this is a upstream product that's not being used. So of course there's going to be more of it. But it does make us pause and say, okay, there's more of these lipids circulating. What can we do to support the metabolism of those so we don't do damage during that time to our cardiovascular system? We know that postmenopausally, we have a higher risk of cardiovascular disease. So that's really important. Anything to add to that, Dr. Rosalie?
Yeah, I just think about menopause or in even andropause as being a time when the cholesterol backbone of hormones isn't necessarily being shunted towards making hormones anymore. So it's, of course, hanging out in the blood more at higher levels than ever before. So it's just, again, it's just a physiological blip that we commonly see, and it's just an indicator, okay, things have to change a little bit. The diet and the lifestyle changes in this new phase of life.
So we got another good question about lipoprotein A, which is one of those markers that's on our cardiovascular panel that we like to do, our heart panel that we like to do with patients. And LPA or lipoprotein A is actually a type of LDL. It's actually a type of the low density lipoprotein, or what we call like the bad cholesterol, right? And it's one that we know is sticky, right? It's sticky to those vessel walls, which is really the concern, is that it could lead to blockages and potentially blood clots. And we don't like that. We don't like that scenario. So we know that because of that, it increases that risk of stroke and heart attack and even irregular heartbeats and rhythm. So we want to keep that low. And what's interesting is when we think about our conventional medical model, which, I should say that there are times that we recommend statins for our patients. So we don't want to vilify that either. There's a time and a place. It's all about individual care and balance for the body. So I will say that statins don't, as far as I know, lower lipoprotein A. What we see instead is diet interventions and exercise being our two most primary components for LPA, and then reducing stressors that are going to cause more oxygenation. Sorry, how do I say that? Help me. Oxidized
Oxidation.
oxidized gas for our vessel walls. So that's like smoking. That's even managing things like stress or not being as physically active, those kind of things. Managing blood pressure. We know that that increases our LPA risk. So that's really what we're thinking about when that marker comes up high.
It's just, to mirror what Dr. Molly said, an independent risk factor of cardiovascular disease in Caucasian populations only. So it doesn't translate well in other minority groups.
And then this next question is a really fun one. It's what's our positions on statins? And I will say that every physician has their own opinion about different medications. And truly, I feel like, we have this education, but it's this art of how we decide to practice. And for us at Prosper, we're pretty evidence-based in general. So we really try to remember that there's a continuum and then there's a time and a place potentially for everything. And to me, statins are a tool. They're not my first tool I'm reaching for, but they are a tool that are appropriate, in my opinion, for some patients. If they have tried these other options and failed, it's an option we talk about. And we do see in the medical literature that there's evidence that some statins are not just lowering cholesterol, but happen to have an anti-inflammatory effect. And that's a huge help in some situations. So once again, time and a place, but we don't start there. we're starting, as Dr. Rosalie said, with those foundational treatments and seeing what we can do there, depending on urgency of the situation. And then if we're not having results there, sometimes we're reaching for what I'd consider like a statin light, which is the red rice yeast, and that can have a really powerful impact. Some people won't need statins once they get on that. It's their lipids are so much better. But if they're still having damage or they are so at high risk because of prior incidences for their body, they're already so degenerated because of damage that's been done, then in my opinion, there can be absolutely appropriate use of statins.
Yeah, I agreed wholeheartedly. It's just a matter of reaching for the lower force interventions first. Oftentimes, I have patients who come to me who've had labs with their primary care physician that say, okay, all of a sudden, high cholesterol, we're putting you on statins. They come to us for a second opinion, and we say, all right, we agree with your doctor, but first, let's do 3 months of another intervention. Okay, we retest the labs, we give that data to the primary care physician, and they say, man, that was a big change. You don't need statins after all, right? So that's kind of the best case scenario that ends up being involving the whole care web, the allopathic docs, the naturopathic docs, and a lot of like the patient work on themselves with diet and lifestyle therapies.
Yeah, this approach is not necessarily the easier of the options, but can be, I think, just so beneficial and so many opportunities and doors open, because usually whenever we're making these kind of changes, other pieces of health are falling into place as well. And I just want to remind us all that, remember that cholesterol is doing a job in our body. So if it's high, then we could be dealing with levels of inflammation that are inappropriate. And remember that cholesterol is trying to go in like a band-aid and fix all this damage along that vessel wall. And so we want to pay attention and say, oh, that's a red flag. Why are we dealing with inflammation? What do we need to do to address that? So that's, once again, that's stepping back and looking at whole picture piece. We have another question, it looks like.
Question,
It's really
yeah.
great, which is about like, do we provide education on plant-based diets? Absolutely. So one of the beauties I feel like of our work is we get to spend time with our patients. So we're not limited to that, like, 7 minutes and out the door. So one of our most important opportunities there is to be able to talk to them about how do you actually implement some of these changes. What are you going to eat for breakfast? What's your snacks going to be? What do you do if you get hungry in the middle of the night? How do you food prep, or where do you access these foods? And how do you keep it within your budget? Like, these are all really important, kind of where the rubber meets the road questions. At this point, I don't have a specific plant-based book that I'm recommending to patients, but there are several like cookbooks and different blogs, and they're good starting places. Dr. Rosalie, you have any thoughts on that?
I have a ton of thoughts about this. Yeah.
Yeah.
It's one of my favorite interventions. So yeah, a lot of recipe sharing that I end up doing with my patients, and specific product recommendations. Yeah. So, remember the naturopathic part of our naturopathic medical schooling includes 2 years of nutrition therapy, as compared to like 6 weeks or one semester for the allopathic physicians. So this is a huge toolbox for us in our treatment plans.
Yeah, so let's talk diets, guys. Okay, well, with this, we're gonna sign off. We've got patients waiting for us, but we so appreciate you guys. Take care, be well. Happy holidays, and join us for the adaptogen talk. It's pretty cool. There's some neat stuff we're going to be sharing. Okay.